Group going, I think we should go ahead and get started. So, welcome everybody. My name is Michelle Lane. I am lucky enough to be the Senior Director for Community Health and Wellness here at NKC Health. And we have a program for you today that I have been looking forward to for about a month and a half. I wish I had this information as a recovering postpartum mom. I know that my daughter is on right now watching and is just so excited to learn the information that these experts have to share. So today we're going to talk about a guide to pregnancy and postpartum care. We've got three experts here, and I'll just give it away to you guys and let you introduce yourself and dive right into the content.
Thank you. My name is Kelsey. I'm a physical therapist here at NKC Health. With me today are Sam and Cassie. Sam is an OT and Cassie is a physical therapist as well. We all have specialized training in pelvic floor therapy from a variety of different companies and things like that, but virtually we all do the same thing. So we'll just kind of give you guys a better understanding of what it is like to have changes in your pelvic floor from pregnancy and postpartum, kind of give you some education about your body in general and the changes that occur as we kind of go through these phases of life. And then one thing that I kind of like to encourage a lot of my patients is that knowledge is power. So the more that you know, or the better that you understand your body, the better off you are going to be in pregnancy, postpartum, and I guess in life. So we'll kind of get started with that. Like she said, we've got some time at the end for questions. And so we'll just plan to save all the questions until the end, and we'll kind of get started here. Maybe. There we go.
There we go.
Okay. All right. So this first slide just kind of talks about the anatomy of the pelvic floor in general. And so your pelvic floor is a group of muscles that spans the bottom of your pelvis and those pelvic bones. It's comprised of over 20 muscles, and there are lots of functions of the pelvic floor, and those functions really depend on position and what you're doing in your activity level at the moment. But generally speaking, those functions are to support your pelvic organs. It kind of helps open and close the urethra, the vagina, and the rectum, and then it contributes to sexual function. And so one thing that is important to remember as we go through all this is that just because we're discussing all this in relationship to pregnancy and postpartum, these things change, these changes occur as we go throughout life. And so I think it's important and necessary to keep up with the health of your pelvic floor, regardless of whether or not you're a pregnant person or a postpartum individual. We still want to kind of keep track of all these things. Go ahead. So some common pelvic health concerns that a lot of pregnant or postpartum individuals experience are urinary and fecal incontinence or leakage. So this can be due to either a weak or an overactive pelvic floor. And so that is really something that's hard to determine, I would say, on your own. That's really where the expert piece of it comes into play. And so oftentimes people assume that because they're having urinary incontinence or fecal incontinence, it's because of weakness, which generally speaking is the case. But there are other contributing factors to that. And so, like I said, that's kind of where the expertise comes into play. And there are lots of questions that we can ask to help kind of better determine those sorts of things. Urinary and fecal urgency. So a lot of times especially from the urinary side, we're talking about diet and habits that change this piece of it. And so specifically when I have my patients that come in and they're telling me that they've got a lot of urinary urgency, especially during pregnancy or in that postpartum phase, we're looking at intake and how that is affecting your bladder. When it comes to the fecal side, obviously we're looking at intake, food intake, and liquid intake to see how that's affecting the different habits that occur. So how our bowel movements are formed, things like that. We also just want to make sure that your pelvic floor is well supported and that we're utilizing our pelvic floor to the best of its capacity. And so we have to factor in multiple different things when we're talking about urinary and fecal urgency. Pelvic organ prolapse, like it says there, can happen with or without childbirth. So this will expand on a little bit more in one of the upcoming slides. So I'm not going to talk about it a whole heck of a lot right now, but it is common. It is definitely something that happens consistently, I would say, for people who have either a vaginal delivery or a C-section. Not necessarily something to be scared of, though. So kind of with that, pelvic floor therapy can help quite a bit in reducing some of those. The next one there is talks about constipation and dysenergic defecation. So we're kind of talking about just the frequency of bowel movements and the type of bowel movement that individuals experience. And so that can be from diarrhea to a pebbly stool, all sorts of different things. But we have to have good coordination of the pelvic floor in order for bowel movements to flow appropriately in the way that we need them to. Another common concern is pelvic pain. So the examples that are kind of listed below there, I'll kind of go into detail on each of those. So the first one we talk about is dyspareunia, which is pain with intercourse. Vaginismus, very similar to that, pain with intercourse, spasming of that pelvic floor. Vulvodynia is more of like an external irritation of tissue. Pubic symphysis pain is the kind of irritation of the tissue between where your pubic bones meet in the front, often described as kind of like an ice pick sort of sensation or feeling. Coccydynia is tailbone pain. And then SI joint pain, there, the last one is very similar to pubic symphysis pain, but is in that back side of your like pelvis, kind of your low back. It's where your sacrum and then your ilium, which are your hip bones, where those two things meet. And so all these sorts of things can happen, like I say, pregnancy, postpartum. A lot of times when people are experiencing some of these things postpartum, it's related to delivery. And so you might have a whole grouping of these things that occur at the same time after you've given birth. And so it's kind of important to remember too that your pelvic floor goes through a lot. When you are pregnant, I mean, you're obviously carrying a load that's changing over an extended period of time, which is a pretty significant impact on those pelvic floor muscles. And so we don't necessarily discount anything that happens by any means, but everything is evolving is my point. And so some of these things kind of come and go throughout pregnancy, throughout postpartum, but at the end of the day, ultimately you shouldn't have to live with any of these conditions. While a lot of people feel like, urinary incontinence, things like that are, that's just a way of life after you've had a baby or whatever. It's not really true. So these things are common, but it doesn't make them normal. So if you're experiencing any of these sorts of things, it is probably time to get seen. Go ahead.
So to talk about more about prolapse. So some of you may have heard of this, some of you may not. Prolapse is, by definition, an internal loss of support to a pelvic organ, typically presents like a lump or protrusion, either falling into or coming out of the vagina. So there are multiple kinds. Cystocele is when the bladder loses support. So I don't know if you can see my mouse, but in our picture here, you can kind of see the bladder has kind of fallen just a little bit. It starts pushing against the front of the vaginal wall here. We can also have a rectocele. So that's when the rectum has lost some support and is pushing against the back side of the vaginal wall. And I like to emphasize against the vaginal wall. It is not literally your bladder coming out of your vagina. It's not literally your rectum. It's those structures pushing against the vaginal wall, and what presents like a protrusion or a lump falling into the vaginal canal is the vaginal wall being pushed against itself. The only one that's actually literally falling is you can have a uterine prolapse, because that is what is attached to the vagina. So that can fall into the vaginal canal as well. There's another one that's not listed here, just to emphasize and just for your knowledge is a rectal prolapse. So a rectal prolapse is when the rectum falls into itself and comes out of the rectum. So that is a rectal prolapse. Like Kelsey said, pregnancy and childbirth is one component that contributes to developing a prolapse. It is not guaranteed. It is likely and common, but it's not like it's going to happen no matter what. It can also develop during, like I said, during pregnancy. It also can just develop in life without a history of childbirth or pregnancy. There is a greater likelihood of developing a prolapse with a vaginal delivery versus a C-section, but again, can still happen regardless. There are times where somebody's pushing for a vaginal delivery and then they end up having a C-section. So again, there's multiple components and factors that contribute to developing a prolapse. Typical symptoms that are associated with a prolapse are the feeling of pelvic heaviness. Hard to tell sometimes when you're pregnant because you're carrying a baby, maybe even more than one. Some people like to describe it more like a feeling of having a tampon in, like feeling like there's something there that's not typically there. Sometimes it's associated with dribbling of urine, like after you've already gone to the bathroom. Sometimes it can cause a level of discomfort during intercourse. Say discomfort, it's not usually true pain, it's more just like uncomfortable. It can also be associated with like incomplete, emptying feeling, with peeing, with pooping. And then the pelvic floor therapy can help with symptoms of a prolapse, and it can help prevent it from getting worse through exercises and other things that we would talk about with you and instruct you in. And there are other things that are other techniques and strategies that can also help before ever visiting anything like surgery and whatnot. Because again, it's an internal structural thing. We can't unfortunately fix that, but again, we can help with symptoms and we can prevent it from getting worse. So in general, we wanted to kind of touch on strategies for protecting the pelvic floor during pregnancy. This is probably something what you guys are most interested in. One of the biggest things is something that we talk about with every patient, honestly, no matter what the diagnosis is diaphragmatic breathing. If you've ever done yoga, played an instrument, sang in a choir, you might be familiar with this. Diaphragmatic breathing is also called belly breathing or abdominal breathing. It's when you breathe in, the abdomen comes out more than the what we call like upper chest, upper thoracic breathing. So instead of doing these kind of breaths, we're doing it more in the tummy, and that uses the diaphragm more appropriately. It helps decrease pressure on the pelvic floor, can help decrease urgency, instances of leakage. If you already have a prolapse or developing a prolapse, decreases the chances of developing a prolapse and the pressure on the pelvic floor. Can help with pelvic pain as well. It activates certain parts of our brain to help with relaxation and stress responses. It's overall just really beneficial. And that's something very easy to practice on our own and with every patient. So perineal massage is something that can be done if we're potentially planning on a vaginal birth, if we're worrying about tearing. It's recommended starting at 34 weeks pregnant, not sooner than that. 34 weeks pregnant. We generally recommend also clearing with an OB in case we have like a high risk pregnancy or anything like that. You can use a tool. There are tools you can buy online, as well as just your finger. And you can also have a partner assist. It's something that's done very shallowly. It's not something deep. And again, we don't recommend starting that unless you're at least 34 weeks pregnant and typically with OB approval. In general, stretching and mobility, it's good for everybody. It's good to move. It's good to stretch. We do a lot of yoga poses in pelvic floor therapy. That would be more like, like child's pose and cat-cow. I think we get into those later in a slide that Cassie's going to talk about. In general, also just staying active, exercising, walking is one of the best things that you can do for yourself. In supporting the core and the pelvic floor during lifting. So the core support helps with those deep activation muscles. Again, I think Cassie's going to kind of explain some of that later as well. But that can kind of help prevent development of diastasis recti. That's that separation of the linea alba. It's that the top core muscle that can develop again in pregnancy and also not. Again, it's not something that happens to every single person, and it can also help, or I mean, excuse me, it can happen other times, not in pregnancy. It can happen at any time in life. So supporting that core just in general with exercise, but then also just during daily functional tasks, like when you're lifting things like a laundry basket, dishes, things like that, can be helpful as well. Again, Cassie's going to explain some of that later. There are other options as well. Supportive belts. Many of them can be purchased over the counter online on Amazon, whatnot, as well as taping techniques. Obviously, if you're not allergic to tape, that'd be more like K-tape or rock tape. There are different placements that can kind of help support that growing belly and that front pull that can kind of cause some discomfort and some pain. And then also just paying attention to preventing constipation. We never want to strain, never, whether or not we're pregnant. Easy things to help with preventing constipation would be drinking water. It's one of the best things you can do for yourself, just like walking. Usually recommended 64 to 80 ounces of water per day. Also fiber. We want to be intaking fiber to help bulk up our stools, make them easier to pass. And then again, something very easy to do would be toilet positioning. So that would be like a squatty potty. It's like the name brand, like Kleenex is to tissues. It's the brand that people typically know. But it's elevating the feet when you're on the toilet, helps relax. It's an anatomical purpose, helps relax the muscle in the pelvic floor that wraps naturally around the rectum when we're just sitting in a normal sitting position, relaxes that muscle to make it easier to have bowel movements. So that's a very easy thing to do is elevating our feet when we're on the toilet. And then in general, sleep positions. Again, as we grow a baby, it's going to get pretty uncomfortable when we're sleeping most of the time. Easy solution would be adding pillows, pregnancy pillows. There's also those pillows that are kind of like a wedge you can put under the belly when you're laying on your side. It's important to also just pay attention to hip, pelvic, ankle alignment. We don't want to be, splayed out with our legs all crazy like. We don't want to be like half twisted. It's good to have a good alignment of everything for support. You can get those half moon pillows again easily on Amazon and whatnot to kind of help with the space in between knees and ankles, and then also offloading the hips. So sometimes when we directly lay on our side, it can cause some hip discomfort. So sometimes quarter turning or slightly turning where our back is slightly back with something behind you to support, kind of offload that hip, which can be a lot more comfortable when we're sleeping. And then something I forgot to mention with breathing. There are also two kinds of breathing in regards to when you are in labor and delivering your baby. Those are called open and closed glottis. So open glottis is when you're doing that diaphragmatic breathing, you're opening things up and you're exhaling as you're pushing and you're moving that pelvic floor. During it, the phrase I learned, at least when I was doing my course, was like you're breathing the baby into the world. Closed glottis is the more traditional thought when you're delivering a baby or trying to labor, is when you breathe in, you hold your breath as you're pushing down to push the baby out. There are disadvantages and advantages to both. So sometimes it can impact pelvic pressure, when you're pushing out a baby vaginally. It can also affect blood pressure if you have a history of blood pressure issues. And then it can also affect the rate of delivery. So sometimes it can take a little bit longer when you do open glottis breathing versus closed. But again, there are advantages and disadvantages to both. So it's kind of, and again, also when you're in it, you're trying to deliver a baby. So you may not quite have a choice. Okay, we just want to add a slide on possible red flags during pregnancy, just things to look out for. Vision changes, confusion, persistent sudden severe or abnormal headaches, difficulty breathing, of course, high blood pressure, if you are ill and have a significant fever, spotting or bleeding, and then fluid in underwear that's not urine. And then, of course, if you're having progressive labor contractions at regular intervals, these are just a few. There are more than that. But in general, you just want to be paying attention to those things, of course. And then if you're ever concerned, just contact your OBGYN. They are They are there for you. They're there to help you. So if you have any concerns, just please reach out to them, call them, or message them via portal at any time if you're concerned about anything. And then labor and delivery. So you have options. Some of you guys may have already been through, if you're planning on delivering here, with the nursing coordinator, you can kind of talk about your preferences and things like that. You can, if you get an epidural versus a non-epidural, if you get an epidural, it will affect your ability to coordinate or feel your pelvic floor during labor and delivery because it is numbing you. You'll be able to feel your legs, but moving them will be very difficult. So they will help you. People are there for you, but being able to feel exactly what's going on will just be different. And of course, if you have an epidural, that will affect birthing position choices. So if you don't have one and you have full function of your legs, you're doing unmedicated birth, you can have other options in how you deliver your baby. You can do that on all fours. You can have one leg up. You can stand. I mean, you have more choices. However, having epidural or not is obviously completely up to you. It will just have to modify on birthing position. Again, other positions, non-epidural, you could do side lying. You can do on your back, hands and knees, squatting, upright. An epidural, typically generally done on the back or supported incline. You can do side lying. Again, there are choices. You're just not going to be able to use your leg, so they're more limited. And then keep in mind also pre-existing conditions can also impact positional comfort. So if you already have a history of hip pain or hip issues, knee issues, back issues, other things like that, shoulder issues, for supporting yourself on different positions, that will obviously impact your comfort during delivery. Analgesics as well are an option. Those are opioids or nitrous oxide. That would be something also to discuss with your doctor if those are things that you want to pursue. And then coordinating the pelvic floor. So again, I mentioned in the epidural versus non-epidural, that would be harder to feel if you have an epidural. We describe it kind of like an elevator. So we give an elevator analogy commonly to our patients. So when we say contraction versus neutral versus protraction. So at rest, the pelvic floor, again, for the elevator analogy, should typically be at ground level. When we want to contract, squeeze our pelvic floor, commonly known as a Kegel, we should be able to come up to the first floor or maybe even the second floor, depending on how strong our pelvic floor is. And then it should come back down to ground floor. When we want to pee, poop, pass gas, or push out a baby vaginally, we want to be able to protract. So it's going down to the basement. So we want to be able to push, stretch, relax the pelvic floor coming to protraction. And then again, when we're done, it will come back up to neutral. So that's kind of the analogy that we like to use to describe as far as coordinating the pelvic floor. Again, you won't be able to feel that as strongly when we are medicated. And then an episiotomy. So an episiotomy is when an OBGYN cuts into the perineum to assist with delivery. It's not commonly as practiced anymore. They do still happen, but it's not as common as a practice as it was back in the day. It's still practiced when there's more of an emergency or there's a concern with baby or mom or whatnot. But again, it's not as commonly practiced, but they do still happen. And there is still a risk of tearing even after an episiotomy, again, with vaginal delivery. So for pre and post management of tearing, again, you're not guaranteed to tear. Again, with or without an episiotomy, it is still common, but again, it's not guaranteed. It does not happen to every single person. And as Kelsey mentioned earlier, it's not also just like prolapse, it's not the end of the world. It's definitely something that can be managed. And again, that's something that we would help you with in pelvic floor therapy, and something also you can talk about with your OBGYN. And then we just added this little picture of labor positions that can be practiced. Again, hands, knees, side lying, yoga ball, birthing ball, squatting, standing, swaying, getting in the shower. Again, this will all depend on if you are medicated or not, the safety of you and baby, and your preferences.
Okay, now we're going to talk a little bit about postpartum. So thankfully, a lot of it looks very similar to when you're pregnant as well. One thing you really want to focus on is your daily body mechanics. So especially getting in and out of bed when we have that C-section scar that's nice and low on our belly. You want to make sure we're not doing anything to strain those abdominal muscles. So you want to avoid things like sitting straight up when you get into bed. And we really recommend you would roll over onto your side and then push up to avoid any strain on that abdominal muscle. Sam already kind of touched on deep core activation. When we say deep core, what we're more referring to is a lot of people think of the six-pack muscle. So that's your rectus abdominis. That's great for crunching, but that's not what we're talking about. We're actually referring to transverse abdominis. This attaches to our spine and wraps all the way around. This helps support us, but also helps us create that pressure and keep everything nice and tight and where it is. We also want to remember appropriate posture when caring for yourself and the baby. So when we talk about this, we mean making sure when you're going to pick the baby up, you're not bending over at your spine and you're more hinging at those hips, keeping our core nice and engaged, and also just being mindful when you're carrying the baby carrier and just walking around the house that you're using appropriate body mechanics. If you do have any tearing, it is really important to keep it clean and take after it. You don't want to get any type of infection. So here are just some things to do. Keeping clean is great peri bottles that make that a lot easier. Witch hazel, cold compress, and then cushions for offloading. Anything you can do to kind of keep pressure off that perineal area is very helpful. As Sam talked earlier, you still want to avoid constipation and straining. This does increase our chance of prolapse. So making sure we're using squatty potties, eating a lot of fiber. C-section scar management. So once you're obviously cleared by your OBGYN, you can start mobilizing that scar, and you can do that in different types of ways. You can use lotion, gently rubbing in different directions. You can use this different types of fabric, vibration. There's a lot of options for that. And then in terms of diet, making sure we're getting our water in every day. If you are breastfeeding, you want to make sure you're increasing. If you're breastfeeding, you want to make sure that you're drinking more water. Awareness of bladder irritants. The top three I'd watch out for are alcohol, caffeine, and carbonation, just because they do irritate that lining in the bladder and make us urinate more frequently. Doesn't mean you can't have them, but just be aware that if you are consuming these, you might need to drink more water to help with that. And then fiber as needed. Okay, exercises for home. Sam touched on diaphragmatic breathing. The important thing with this is that we're lengthening that pelvic floor. We're allowing it to go through its full range of motion. We included just some examples of stretches, child's pose, happy baby, cat cow, common yoga poses. Just while you're doing this, making sure that you are fully belly breathing. You want to see no chest rise and that you're inhaling slowly through your nose, exhaling through your mouth. For core, that's where we're going to focus more on that deep abdominal activation. So you want to avoid things like abdominal coning. If you're doing something and you see your tummy bulging out, that's an example of abdominal coning. And then making sure that we're doing this throughout our day. So we kind of talked about earlier with like carrying baby, lifting things up, even just your normal homemaking stuff like carrying a laundry basket. You want to make sure you're staying engaged, as that's going to help you better manage your pressure and diastasis recti prevention. And then in terms of pelvic floor coordination, this is different for everyone. That's the Kegel we were talking about. And it just kind of depends on where you're at. Everyone is so different. So there's no like right or wrong answer for each person. And that's where we can come in and kind of help you identify exactly how to activate it. And if you're activating the best place for where you're at in your recovery. Do you want to? Okay. When should you come see a pelvic floor therapist? Just some common questions to ask yourself. So are you frequently going to the bathroom? Do you have any accidents, leaking with either urine or fecal leakage? Any pelvic pain, whether it's just in standing, at rest, with intercourse, pelvic pressure or heaviness? And then also too, if you just want to prepare for labor and delivery or have some more one-on-one sessions to kind of go over what to expect and how you can better work on breathing, engagement, things like that. So here's all our information at NKC Health Physical Therapy. We have trained pelvic floor therapists. They are all female. They're both occupational and physical therapists. We do have all private treatment rooms where you'll be performing your treatments. You can have a referral from your doctor to come see us, or you can see us without a referral. And then we do offer multiple locations to serve you. So I believe we have 4 in the Northland that we have pelvic floor therapists at. So if you are interested or have any questions and want to come see a pelvic floor therapist, we have listed our number below to call and schedule.
That was so good. That was so absolutely interesting. I'm going to allow people to come off of mute and ask questions. So I'm going down the list of attendees now. So if you do have a question that you want to ask, feel free to come off mute. I've given that permission to everybody, or if you want to remain private, you can put that in the chat as well, or the Q&A section, whichever you feel more comfortable with. So one of the things that was new to me, and I don't know why, I'm a nurse, but talking about the diaphragmatic breathing, I hadn't even given that thought at all. I am completely just a lung breather. So I think that is really, yeah, it
almost
is.
almost everybody is.
Yeah, I just was like, okay, mind blown. I hadn't even thought of that as a way to help my pelvic floor, but it absolutely makes sense when you explain it so well. So thank you for that information. I'm going to look in the chat and see if anybody has got any questions at all. No questions so far, but absolutely, that was so informative. One of the questions on a personal level that I think is important is when is like the first time, if you're pregnant, should you meet with a therapist first and like start to learn some of this stuff? So then as you go through your pregnancy, you have less problems. Is that recommended or covered by insurance at all? Or what do you guys think?
Yeah, so generally speaking, it is covered by insurance. And I mean, obviously, we're therapists, so we believe that everybody should come see us as soon as possible, but there are a lot of benefits to it. So, kind of with each of these things that we had talked about today, there's a lot more that we can expand on, and we can kind of work through each individual person and their body type and their preferences and the things that they're doing on a regular basis. I think one thing that scares a lot of people during pregnancy is movement and exercise. And so, a lot of people don't. They're like, oh, well, I'm pregnant, so I shouldn't lift, I shouldn't carry, I shouldn't do all these things. But there are lots of things that you can do that are very safe to do. And we're more than happy to teach people how to do those sorts of things. But I think it's really important to come see a therapist during pregnancy. A lot of people will wait until they're like, later into their second trimester or third trimester when they're starting to have issues. But truthfully, I mean, even starting in the first trimester, it just is more of a preventative thing. We do a lot of like maintenance and prevention and things of that nature that are really beneficial and helpful to people.
And to go along with that, there's a lot of things you can do just in functional daily movement that can help support the pelvic floor, support the joints, and your belly as it grows.
Love that. We have a question in the Q&A. It says, do you know of any person or in-person classes for Lamaze? Do you guys know of any Lamaze classes that are going on?
Not specific to that. I don't know. Celebrity Hospital, do you know? I don't really know, to be honest.
Me neither. Okay. Fabulous. Well, I don't see anything else in the chat, but let me make sure. No. Awesome. Well, you guys did an amazing job. Thank you so much, everybody, for joining us today on this wonderful information about our pelvic floors. Take care.
Thank you.
Thank you.